Health. Dr. Charles Bradley welcoming you back. As you know, February is Pet Dental Health Month, and we've got a little setup here, just a mock setup, to show you what goes into preparing for veterinary dentistry. All veterinary dentistry, I feel, and I think industry feels as well, should be done under full general anesthesia. The reason for that is we want patient restraint. We don't want to hurt animals. And we also have a platform available if we find anything wrong. So the instruments are sharp. Animals are very fearful, so we don't want them to be upset. So we do general anesthesia, and that's why the cost is much higher than most people would appreciate. So probably the two biggest drivers of cost would be the general anesthesia, and you can see this is the general anesthetic machine. And then the other big game changer that I've been doing since about 1988 is dental x-rays. Dental x-rays allow us to see below the gums, and we have a special software program that we use here, and I can get pictures on the animal directly. And what we do is we have a sensor that comes from the computer, and this will go into the pet's mouth, and we will take a dental x-ray just like a person. So this is very similar to what we used to have, the little bite wings, but you can see that there's a very rugged tether, this electronic cord that goes into the software, and then I have my dashboard here, and I'm able to, in real time, look at the teeth below the gum, and that's a real game changer. So it's very hard to know what is going to be the final price, because we do really 3 phases of dentistry in a single event. So once the pet is anesthetized, we clean the teeth up and we take the dental x-rays. Then we can come to a diagnosis. We can actually find out what's going on. So the oral examination or the examination of the teeth is only after the anesthetic and after the dental x-rays. Then the doctor comes in, that's me. I do all 3 phases. I do the cleaning and the x-rays, and then I look at the x-rays. I'll sit down here at my dashboard and I'll try and figure out what's going on. And then I make an estimate as to what the treatments are. Usually we've talked this through in advance, but we may call on the phone and speak to the owners and get permission. And then if there's additional work to be done beyond the cleaning, then we have the x-rays that help us, and we can get into oral surgery. So let me show you some of those oral surgery tools. This is sort of like just a random example of some of the tools that we have, and this entire bank is all tools, all dental stuff. This is our high-speed dental unit that provides a slow speed and a high-speed dental drill and air water syringe. You might be familiar with these small tools here. For example, this is a curette, which is used to clean teeth below the gum line. A lot of veterinary dentistry does not involve that extra care, and that's very important because in the diagnostic phase we use what's called a periodontal probe and a shepherd's hook, and this is used to probe around each individual tooth. I use this tool, this black tool, an awful lot. This is called a curette, as I said, and this allows me to do periodontal surgery, so I can get inflammation out from underneath the gum and try and save teeth. So this would have come first, and then there may be occasions where, well, there may be occasions is an understatement. Very often we have to extract teeth. So we have all the oral surgery tools here. For example, this is an elevator, and when I'm sitting here at the end of the table working with the pet, I pretty much know which tool I want. And there's so many tools, I usually don't get them all out in advance because I can't remember situationally what I'm going to do, but there is a real need for specialty equipment, and each one of these items can cost $100. So it's just another word for expensive. So we talked a little bit about the surgery. I'll tell you what's going on in this visual field. It's very complicated, obviously. We've talked about the dental high-speed equipment here. On top here we have a scaler. So we take the stack, this is called a magnetostrictive system. We put this in, and this is like a scaler that you will have in human dentistry, and we can debulk the calculus. It takes a long time to clean, say, a German Shepherd's mouth, especially if it hasn't had any dental care for, say maybe 10 years. So this is the cleaner. And then we have the dental x-rays. We perform dental x-rays on every patient virtually. In terms of anesthesia, let's get into the anesthetic a little bit. I'll just step out and I'll show you. We perform general anesthesia on patients, and we have a secure airway. This endotracheal tube will be inside the animal, and it'll be hooked up to this gas anesthetic machine, and we control the oxygen here and the anesthesia. A typical setting might be 1 to 2% isoflurane and 99 to 98% pure oxygen. And that is a typical thing that has to be monitored, and we maintain the anesthetic throughout. And we have a dedicated veterinary technician anesthetist with me at all times. So typically there'll be 2 to 3 people here. We will have somebody doing the anesthetic at least. Usually there's another person doing the monitoring, and these machines at the back here are monitors. I'll just pull this little guy out so we can see better. So I'll talk about this bear hugger in a moment, but this is a monitor which will measure parameters like oxygenation of the blood, dissipation of carbon dioxide, heart rate, etc. We have a blood pressure monitor dedicated. That's called a Doppler blood pressure monitor. We do that. We have IV fluids going in, and we have 2 ways to maintain heat. We've got a Gamar heat pump, and that's maintaining heat underneath the animal, and we have what's called a bear hugger. This is a warm air blanket of air that is over the patient, because these procedures can be pretty long. We can have up to a 3-hour procedure, and we want to make sure that the body temperature is maintained. So prevention is the key. We've talked about that before. Brushing the teeth prevents all of this. Brushing of the teeth every day, taking that extra effort, is what I always ask of people. And some of the smaller breeds, they have to visit this table once a year. I was looking at a small breed dog today, and we chatted about the merits of dental home care, but the profession is encouraging you to brush the teeth of your pets, especially dogs, small dogs, cats, and think about veterinary dentistry once a year. But the bonus would be that if you can keep the teeth clean, you don't have to visit this station. We don't have to do a general anesthesia. That notwithstanding, I'd much rather anesthetize a dog and get rid of all of that unhealthy gum, inflammation, calculus, tartar, which is a reservoir of infection for the body. I'd rather take that little risk here, which is quite low statistically, and try to preserve health and try to identify problems. That's what dentistry is. It's a lot to unpack, but thank you for spending the last 5-6 minutes with us here at Domino Veterinary Hospital. I appreciate you spending time. Facebook Live, Dr. Charles Bradley speaking. Thank you.